Welcome to the Breaking the Silence webinar series, everyone. My name is Candace Fair, and I am the Community Enhancement and Development Officer with CASA Foundation, which is the fundraising arm of CASA, Child, Adolescent, and Family Mental Health. We raise money to support CASA services and raise awareness about children's mental health. We are honored to be partners with the Mental Health Foundation to bring to you Breaking the Silence. Both organizations are passionate about mental health care and are grateful that the Breaking the Silence team has brought us together to share resources and support with all of you. We are so happy that you are able to join us today. It is more important than ever to recognize and show our respect to the Indigenous people of our country through a treaty land acknowledgement, which is an act of reconciliation to recognize the traditional territory of the Indigenous people who were the first to call this land home. Today, we acknowledge that we are on sacred Treaty 6 land, the ancestral land of the Cree, Saulteaux, Blackfoot, Métis, Dene, and Nakota Sioux. And we recommit to our promise to live together on this land and take care of one another in these difficult times and always. With tonight's session being virtual, there's just a couple housekeeping items to take note of. We want you to know that today's session is being recorded, and we will share that with all participants afterwards. We'll also be available this session on the Breaking the Silence website for a limited time. And we ask that tonight you use either the chat function to submit questions, or if you'd like to remain anonymous, you can use the Q&A function. There'll be a section towards the end of our evening for question and answers. All right, so talking about our session tonight, what we'll be exploring is supporting those considering suicide. And talking about suicide can be a challenging but very important conversation. This webinar will provide helpful and concrete information about how to recognize the warning signs and how to support someone who may be at risk. The webinar will include specific ideas about how to prepare for and engage in the initial conversation, what not to say, what to say, and as well as how to determine if there is an immediate risk. The importance of being non-judgmental while conveying compassion and empathy will be highlighted. And additional information about risk and protective factors, higher risk groups, and self-care will also be discussed. Lastly, key community resources and information about free suicide prevention training provided through Living Hope, a community plan to prevent suicide in Edmonton, will be shared. Our presenter today is Leanne Jondo. She is the citywide community building social worker with citizen services at the City of Edmonton. Welcome, Leanne. Thank you so much for being here this evening, and we look forward to what you have to share.
Thank you, Candace, for the introduction, and good afternoon, everyone, and welcome to the Having the Important Conversation Supporting Those Considering Suicide webinar. I hope you're all doing well on this afternoon of a bit of rain, which I think has been much needed. I'd like to share that the fundraising and increased awareness goals that happen through Breaking the Silence are truly amazing, and I'm very honored to be part of the event. So as Candace mentioned, my name is Leanne Jondo, and I'm a social worker with the City of Edmonton, where I've been for the past 20 years. And for the last 6 of those years, I have provided project management support for Living Hope, a community plan to prevent suicide in Edmonton, which is an implementation plan that has sort of 3 primary goals. And I won't spend too much time talking about it, but just provides a bit of context. The goals are to increase awareness and education, hence participation in Breaking the Silence, to enhance the accessibility of the full continuum of services, and to address the specific needs of populations that experience a higher risk of suicide. So we have a number of objectives and activities within the plan, but they fit within those 3 goal areas. If you're interested in the details of that plan, feel free to go to the City of Edmonton website, and you can use the toolbar to look up Living Hope or suicide prevention there. So wanted to just share, Candace provided a good overview, but specifically what will be covered today, we'll take a brief look at suicide rates in Edmonton and the impact of COVID-19 on suicide rates. We'll spend some time learning the signs of suicide, the warning signs. We'll review the key risk and protective factors, as well as identify the groups at higher risk. We'll spend some time talking about the details of how to have that conversation, how to determine immediate risk, and some of the things you can do if you determine that. And I'll emphasize the importance of following up and of self-care, and I'll conclude with some key community resources. We can only cover so much in the time that we have today, so I would encourage you to consider taking further training in this area. There's lots of training that's available in the community. I have included some of the free sponsored training that is offered through Living Hope, and I'll share that with you at the end of the presentation. So suicide in Edmonton. So last year, the preliminary data, so this is not the official data, suggested that we had 104 people who died in Edmonton, the city, the municipal boundaries. And this is the lowest number we've had in many, many years, with the average for the previous 8 years, for example, being 145 people. So we saw a dramatic decrease in the rate of suicide and the numbers of suicides last year, which is terrific news. The 2018 was the most recent year for which we have official statistics. And in that year, 178 people died by suicide in Edmonton. And that was not just in Edmonton, however, it was Edmonton and area. Usually, most years, there are more than twice the number of deaths by suicide than there are deaths by car accidents in Edmonton and area. And with regards to the populations most at risk, and we'll certainly talk about this more detail later, the situation in Edmonton is similar to in most other areas globally, in that middle-aged men remain the highest risk of suicide. More women attempt suicide, but because of the lethal means used by men, their mortality rate is higher. We also know that suicide rates in Edmonton are more acutely felt and experienced in areas of the city that have greater social and economic challenges. So the impact, I won't spend too much time, but many people have asked what have the impacts of COVID-19 been on suicide. And as I mentioned earlier, the suicide rates have gone down, in not just in Edmonton or Alberta, but in many places. But thoughts of suicide, suicidal ideation has gone up. And this has been shown in multiple surveys, both local and national. Some groups are more impacted by suicide or have experienced more suicidal thoughts. And those groups include Indigenous people, racialized groups, individuals who identify as 2S LGBTQ+, those with disabilities, and those experiencing mental illness. So on the one hand, there's certainly been increased risk factors due to unemployment, financial stress, increased anxiety, and social isolation. But on the protective side, there's been a number of key things that have happened that we think have had bearing on the lowered rates that we saw in 2020. So governments have responded, various governments have responded with enhanced financial and mental health supports. There's been more focused efforts on supporting at-risk individuals. Many people have observed that we've connected in new and different ways than we did previously. For some, relationships may have been strengthened by increased time spent with immediate family members in the home. Some of the stresses from working and going to work may have been reduced. And there's also the sense that being in this thing together, this large event that happened to everybody, is one of the results. It wasn't an individual thing that we feel individually to blame if we're experiencing a lot of stress. Also, we know that there were increased calls to mental health crisis lines and other suicide-related crisis lines, which is a good indication that at least people are engaging in help-seeking behavior. And COVID has heightened our awareness of mental health and the resources available to us. So hopefully, perhaps more people have become more comfortable reaching out for help and accessing the services that they need. In any event, the long-term impact of COVID on suicide rates is not yet known. It may be that the consequences of COVID-19 are likely to be present for a long time and peak later than the actual pandemic. But I think we can be more confident that the supports that we have currently in place will need to be extended for some time to create the same level of protection. So 11 of Us is the name of the Living Hope public awareness campaign. It was launched in the fall of 2019 and is still running today, albeit not as intensely. The campaign has consisted of various forms of advertising on TV and billboards, social media, and a website. And much of what we'll be talking about today can also be found on the 11ofus.ca website. And we really hope you would consider looking at their website as a helpful resource to you. There's no need for those of you who are keen note takers, there's no need. You can find much of this information, as I suggested, on the website, 11ofus.ca. So I thought it might be helpful to spend the next few moments thinking about the signs. We don't know who to help unless we identify some of the warning signs. So I'm going to review those here. Before we do, it's important to note that not everyone who shows one of these warning signs is considering suicide. And certainly not everyone considering suicide will show any of these signs. Each situation is unique for each individual. If you see many of the warning signs showing up for someone you care about, it would be an indication that something challenging and problematic and troubling is going on for that person, whether they're considering suicide or not. So we'll start with the dramatic mood swings as the first sign. We all have mood swings from time to time, but this sign is really talking about the sudden, frequent, or severe changes in mood that are concern. The next slide we have is isolation and withdrawal. When someone withdraws from their family and friends or stops showing interest in activities they used to enjoy, they may be isolating themselves. And of course, during recent times where social distancing was recommended as a public health measure, identifying social isolation and withdrawal might have been challenging. But as things open up and you notice that someone is not returning to the social or recreational activities that once brought them joy, this might be an indication that something is going on for them. And it might be helpful to check in on them and see how they are doing. The third sign that we'll talk about briefly is writing or talking about dying. So these statements can be obvious, subtle, or they may even look like a joke. In fact, often they're couched in the appearance of a joke. But people also might say things like, I just can't take it anymore, I want to die. And even if it sounds offhanded, they could still be genuinely considering suicide. So it's important to take these statements seriously, even if they look like a joke or an offhanded comment. It's important to look further and ask and observe, see if they're serious, and feel free to probe a little bit further. These aren't these jokes that should be just left in passing. So a couple more warning signs are talking about feeling like the person is a burden. We've all heard statements about somebody who's died or attempted suicide that involve some version of how could they do that to the people they love? How selfish that is. But the reality is quite different. Many people who engage in suicidal behavior experience profound distortions, and they actually believe the opposite. If someone is talking about being a burden to friends, family, and others, they could feel that they are weighing them down and that they don't see another solution other than suicide. They may feel like they're making things better for those that they love by killing themselves, not worse. If someone, the next slide, put that up, if someone expresses feeling trapped, they may not see how their situation can improve, and they potentially don't see another way out other than suicide. There can often be a kind of tunnel vision that takes place, with the incorrect conclusion being that suicide is the only viable option to ending the pain that they're experiencing. This, of course, is not the case, but this may be how it appears to that person. So the third sign on this slide is those considering suicide talking about having a lack of sense of purpose or no sense of purpose. They may feel that their life is meaningless and worthless. They may share that their life feels pointless and hopeless. It's important to be really curious and to delve more deeply into these comments and to explore to what extent these are overwhelming or passing thoughts and feelings. And even if they appear to be passing thoughts and feelings, they really should be something that you should explore further with them. A few more signs. Anger, agitation, and anxiety. These, of course, are normal human emotions, but when there's a significant change, when they are uncontrollable, when they happen often or last a long time, they could be a sign of something more serious. Changes to sleep patterns can take the form of lasting or significant changes. They can involve sleeping more often than usual, sleeping restlessly, or not sleeping at all. If someone seems tired all of the time, it's a good idea to ask them if they're doing okay. There may even be other reasons for that. But changes to sleep may be an element of a mood disorder like depression, or it may be the result of acute stress. Either way, it's helpful to find out what they're going through and what may be causing some of their changes to sleep. So another sign is recklessness. This may be a sign that someone is not valuing whether they live or die. If you notice someone who's acting dangerously in ways that risk causing harm to themselves or to others with little care about the consequences, that is a warning sign that they might need some help. Got two more. So if you notice an increase in someone's drug and alcohol use, this also could be an indication of something more serious going on. People often misuse drugs or alcohol as a means of self-medicating or of coping or escaping their circumstances, worries, or previous trauma. What may feel like a solution in the short term, however, becomes a risk factor in and of itself, as alcohol abuse can make a person more impulsive, unafraid, or disinhibited, and it can impair their judgment and ability to problem solve. And in fact, alcohol is found to be present in a number of suicides and is particularly elevated in those who have, the risk is particularly elevated in those who experience chronic alcohol dependence. And they are many times more likely to engage in suicide behavior than those who don't have alcohol dependence. So the last sign we'll talk about today is the giving away of possessions, especially favorite or valued items. Or showing you where they keep important things such as money, keys, wills, that kind of a thing. If this does not make sense given the person's life circumstances, then it may mean that they are making preparations as part of their plan to end their life. So now that you're more familiar with what some of the warning signs are, it may be helpful to consider what some of the more relevant risk and protective factors are. This may help you further establish someone is in fact at risk, but it also may help you delve a bit into, it may give you some sense of direction into delving what might be going on for them and what they might benefit from as well. So I would say that suicide is the result of a complex set of factors. There's rarely one single reason that somebody engages in suicidal behavior or decides to kill themselves. And the prevention of suicide must also reflect this complexity. There's no one individual factor that makes someone suicidal, and it's a combination of things that will prevent their risk. So some of the key risk factors that we wanted to review here, and again, these are just to help you determine what's there as a risk and what's there as something that may be protective to someone. But a risk is mental illness and addictions. We know that certain mental illnesses, such as depression and other mood disorders, have a greater risk of suicidal behavior associated with them. And we've just spoken about the risk with addictions, particularly alcohol use, but that it does exist with all substance abuse. Social isolation is a risk factor. We're social creatures who need positive social contact, and we don't have this. It can lead to increased risk. It is also less likely that those who are socially isolated have people supporting them to get the help that they need, or with other underlying risks and stressors that they may be experiencing. Another risk factor are major life transitions. And sometimes this can be surprising because it sometimes can seem positive on the outside, such as graduation or retirement. The losses, however, that come with these transitions, the new set of stressors and the changed social environment with potentially fewer social supports may in fact increase the risk. And sometimes people aren't able to cope properly with the changes that the new circumstances bring. They might be quite used to the way things were, and the new set of circumstances, again, even if they seem positive, might be stressful in and of themselves. Another risk factor is when there is a family history of suicide. This may be the result of complicated grief or sharing of some of the same stressful life circumstances as a person who died by suicide. Physical illness is another risk factor, especially those that have painful outcomes and involve a great deal of pain. Trauma, we know from a whole lot of studies about the links between childhood as well as later in life traumas and suicide, and that's pretty well documented. Oppression and discrimination is another risk factor. And we'll talk about that a little bit later when we talk about higher risk groups. But these are risk factors that are felt most acutely by certain groups. They may feel like their worth is not recognized. Their options for safety, security, and happiness are limited by their identities or their inclusion in particular groups. So the last risk factor that we'll talk about here is poverty. And people experiencing poverty may feel that their options are also limited, and certainly their access to helpful resources may in fact be limited. But poverty comes with a set of acute stressors and is often accompanied by feelings of hopelessness and worthlessness. That is not to say that everyone who experiences poverty is automatically at risk, but it may be, given the other sets of experiences that they have, one of the contributing factors. So on the other side, the protective side, there are a number of protective factors, and you really want to look for these too when you're talking to somebody, because these are the things that you want to build on. So positive coping skills is a protective factor, and some of the most important being problem solving, believing in solutions, and engaging in proactive and healthy behaviors. Social support, having people around to offer care, compassion, validation, help. These are all vital as a protective factor. Healthy relationships are protective, especially those close relationships where trust, intimacy, and safety can be felt. Reduced stigma, and that's something we all have responsibility for, related to mental illness and suicide is an important risk factor. And this reduced stigma encourages people not to blame themselves and to seek out treatment that they need. A sense of purpose is protective, as this allows people, whether they're in crisis or not, and it provides them a sense of direction, comfort, and a reason to keep living. Good health, especially for those who are free from debilitating pain. And good health also means adequate nutrition and sleeping, all of which enable a person to think and cope at their best. And the last one here is help-seeking behavior, which is a very strong protective factor, and we encourage it. And this results in people seeking out the help that they need, whether they're in crisis or not, to make the short and long-term changes that are needed for greater happiness. So who is at risk? And I won't spend too much time because we've sort of spoken about some of these before, but middle-aged men, as mentioned, they use more violent means. And we've also observed that many men experience more social isolation and find it more difficult to get the help they need when they experience depression, loss, or major life events. The 2S LGBTQ plus individuals and communities may be at higher risk because of the the discrimination and gender barriers that they may experience. Some Indigenous peoples experience higher risk because of the underlying risk factors they experience, such as discrimination and intergenerational trauma. First responders are at higher risk, and it's believed to be because of the acute stressors they face at work that may lead to what's common for many first responders, that being post-traumatic stress disorder. Survivors of suicide, as I've mentioned before, including friends and family members of someone who's died by suicide. They may experience complicated grief that's made worse by potential stigma, trauma, guilt, confusion, and those things can be quite unbearable. So people with the last group of people at risk are those living with mental illness or addiction, which we've talked about already. So having the conversation. So now that you're more familiar with the signs and the specific risk factors, you're better prepared to have that conversation with someone you are worried about. You have sort of a set of things that you can indicate or that you can point to yourself or the other people that provide a grounding, a foundation for your concerns. So a couple of things. You don't need to wait for the perfect time, but it really does help if you can take a moment and think about how you'll begin and how you'll start that conversation. So a couple of things to consider before you start that conversation. It's helpful to learn in advance what supports in the community and what resources are available. This will help you be prepared if the person needs more help than you're able to offer. And that's whether or not they are experiencing suicidal thoughts. There might be other places that you might be able to refer them, but giving some thought to what they might need and finding the resources will just make that part of the conversation more smooth. So plan to ask the person and to have the conversation at the right time in the right place. Most people will share and be forthcoming and truthful about how they're doing if they're in a comfortable, private, and quiet environment with few interruptions. It's also helpful if you can make sure that you have the time to talk in earnest about what's going on with them rather than being in a rush. Oftentimes people are quite guarded at the beginning, so you really want to make sure that you have enough time and the right space to be able to have that conversation. So be ready to talk about what you've noticed and offer specific examples of behaviors that have made you be concerned. And also, before you have that conversation, think about and address your own stigma so you don't carry them into that conversation. This conversation is really supposed to be about focusing on the other person's needs and their circumstances and less on your own biases. We never do anything 100% free of biases, and we know that stigma is powerful. But if we can spend some time thinking that through, talking to someone else about that so that we can go in with the ability to focus on the other person's needs, that's quite helpful. So lastly here, just a suggestion to prepare yourself emotionally to have a conversation that is likely to be challenging, but that really might make a big difference to the person that you are talking to. So whatever it takes for you to feel prepared emotionally, whether that's reading or talking to someone or making notes or whatever it is, just prepare yourself emotionally to have that conversation. Couple of conversation starters are helpful because we know suicide is really hard to talk about. We know it's stressful and uncomfortable for most people. It does take courage and the knowledge that you can make a difference. So a couple of conversation starters, and they sound pretty casual, but they're meant to just be the opening door. So You can say things like, hey, I've noticed you've been acting agitated lately, and that's not like you. Is everything okay? Or say, asking things like, I've noticed you've been joking about wanting to die a lot lately. Is everything okay? Because those jokes don't necessarily seem that funny to me and they make me worried, or whatever is in your own words. Another prompting, kind of opening the door question is, hey, you don't seem yourself lately. Do you want to talk about it? Which, of course, is really, really general and allows them to share whatever might be going on for them. So just a kind of quick sort of, not summary, but kind of the highlight of the main ways to have that conversation. Notice the warning signs. And of course, that means consider some of those risk and protective factors, but in particular, the risk factors. And then listen. Listen closely and without judgment. You don't have to have all the answers. And just listening to someone can give them the support, especially if it's non-judgmental listening and empathic listening and validating listening. It may give them the support that they need at that moment. So asking the question, asking directly. So this is really challenging for most people. So when you come to the point in the conversation where you do feel it's appropriate to ask if they are considering killing themselves, you want to reflect the words that they're using, but you want to do it in a way that's really direct. Try not to replace suicide with hurting yourself. If they're considering suicide, ask them, are you considering suicide? Are you considering killing yourself? It's very awkward. It's challenging, but hearing them use the words, having them hear you use the words is really powerful and direct. Asking about suicide will not put the idea in someone's head. It will show them that you care and that you're actually someone safe they can talk to about what they're experiencing in a really direct and clear and straightforward way. They may be even relieved to have the opportunity to talk about it in such a way. So the last thing here is to share. Let the person who's considering suicide know that this is serious and that you genuinely care about them and the pain that they're experiencing. Tell them that you want to help them and that there are resources that are out there to help them and that you have hope that their circumstances can get better. We'll talk about that more in just a minute. Wanted to just spend a moment talking about some of the things that are helpful and some of the things that are not helpful. So we can end on a more positive note in the slide. I'll start with the things that are not helpful. So acting out in frustration and telling the person to just go ahead and do it is not helpful. In fact, it's dangerous. It's the last thing that they want, that person needs to hear. They need to hear that you care whether they live or die, not that you're trivializing or making the disclosure about you and your frustration. So telling the person that they are being, telling the person that they are being selfish or cowardly, they are already suffering and they need your care and compassion. And as we talked about before, likely they don't see themselves as being selfish. Likely they in fact feel like they're doing the opposite in considering suicide. So one of the other things to avoid is saying things that dismiss the person's feelings, the seriousness, or the reasons that they're considering suicide. Aim to listen with empathy while taking the person seriously, as this will help them feel heard and understood. Don't accuse them of just looking for attention. If a person is talking about suicide, they are suffering on some level that is meaningful. The painful emotions are real for them and they need caring attention and not to be dismissed. So a couple of the things to make sure that you do are to be calm, non-judgmental, and share that you care what happens to them. Thank them for bravely sharing their thoughts and feelings. It's very challenging to have the bravery needed to have the conversation, but it's also requires a lot of braveness to admit that that things are that difficult and that that person might be considering killing themselves. So showing empathy at all times is so important, and being non-judgmental is really, really critical. And also focusing, in this, we mentioned this before, making sure that when you're in the conversation that you're focusing on their feelings primarily and less on your own. There may be a time and a place where you can share what impact that had on you, but this is really a time to focus on what they're experiencing. So you first have noticed the signs that someone might be struggling and considering suicide, and then you've had the conversation and you've asked the question, but what happens if when they tell you that they are in fact suicidal? You need to determine whether that risk is imminent. Someone may have a vague idea, a long-term plan, or maybe something that they're considering very, very soon. So here are a couple of red flags that indicate a person might be at higher risk right now. So they've made a specific plan, and it's a detailed plan, and it's a feasible and realistic plan. They have, which is related to the second point here, which is that they have access to the means to carry out their plan. So if they're talking about using a firearm or prescription medication or whatever it is, that they have those things accessible or already in their possession. If they've done research into ways to die in a way that feels serious to you, or even if it doesn't feel serious to you, but they've looked into it and indicates that there's more than just a casual thought. Typing the words, looking things up, having conversations, those things certainly indicate that there's much more intentionality behind their thoughts than otherwise. So if they've started to actively prepare for suicide, gathering the items, giving away possessions, those kinds of things, though that would indicate that there's more imminent risk. If they've rehearsed their plan, they've gone to the location, or they've tested out what they were going to do, is certainly very concerning. If the time that they've chosen is in the near future, that's very alarming and indicates that you need to respond more quickly. And if they've made clear statements that they will end their life, people can tend to be a little bit more vague, but when they've come to the point of making clear statements, you need to take that seriously and recognize that there's imminent risk in that. So if you've determined that someone is considering suicide right away, you can make a plan to keep that person safe. Ask if they have the access to the lethal means, and if they do, and I say this very carefully, if you're able to do so only with safety, consider removing the items or encouraging the person to leave that environment, but genuinely only do so if this is safe for you to do that. If they're in immediate danger of becoming injured or dying, call 911 or go with them, if they're willing, to the nearest emergency department. The person is not in immediate danger, but you're still quite concerned about them, ask them what would help them keep safe until they get the support they need. Now, some people talk about creating safety plans, those kinds of things. That might be something that you do, and certainly there's training that will help you look into that more, because that can be a whole conversation in and of itself. And it may be something that's involved. Some people will find contracting with people on their safety plans and having them sign or promise. There's various different approaches that various different training modalities have. And it can be one of those approaches, or it could be as simple as just promising that they can follow up with you in the next hour, 2 hours, the next day, whatever feels like might be important at that moment, but you want to make sure that you have a time that you can check up on them. So it's also, I think, something to consider seriously, to use the resources in that person's network, like family or friends or existing close relationships with healthcare practitioners. This is not the time for privacy. If you've determined that there is a higher level of risk, you want to share your concerns about the person with compassion and respect, but this is not the time for privacy. You need to involve individuals who that person trusts to provide them support and assistance, but you want to do that in a really, really careful and respectful way. So following up, so after that initial conversation, which is a significant beginning, it's important to follow up with the person who shared their suicidal thoughts. Some may never feel suicidal again, and others might revisit the option again and again. So staying in touch will not only show that you care about their well-being, whether they're in crisis or not, will also give you an opportunity to see how they're doing. So it's important to make the time to listen to and to hear from them how they're doing and how they're coping, to ask them if they've been receiving help, supports, or treatments they need, to offer encouragement and support for healthy choices and behaviors, to share that you're glad that they made the choice to live and that they matter to you and that you care about the relationship. And at these times of following up, it's important to consistently show compassion and empathy for the struggles they experience and to find out if they're still considering suicide, and then to encourage them to stay in contact and continue talking with you. So it's important to take care of yourself too. It's important to know your own boundaries. You don't need to be an expert. You're there to support your friend or family member or coworker by listening to them and letting them tell their story. But you're not the expert. You're not there to solve their problems. You're there to listen and support them in a way that is helpful and to potentially help them find those resources that are professional that they do need. So it's important to recognize when professional support is needed by that person, when you feel that risk is escalating or things aren't getting better and that you have growing concerns. And it's also important to seek the support of your own loved ones and sometimes professionals if you feel like that you need it, that the stress and the worry is becoming very concerning to you as well. So there's a number of community resources that are out there to support individuals and you actually as a person who's supporting them. So as we mentioned before, 911 is there for emergencies or where there might be imminent risk to safety, but that's really the bar. It's for imminent risk and urgent situations. These other resources are there when it's not imminent, but you're still quite concerned. So we have the Access 20 for the Alberta Health Services Access 24/7 Adult Intake Services line, and they provide a whole suite of crisis to treatment options, and it's a centralized intake number. And it's obvious, like the name says, it's open and available 24 hours a day, 7 days a week, and you can phone or they can also walk in. The address is in Anderson Hall, just next to Royal Alex. So in the province, there's the Alberta Health Services Mental Health Helpline and the Addictions Helpline, and those are also 24/7. And then, excuse me again, there more locally is the Distress Line, which is run by the Canadian Mental Health Association. And they actually also now, as of June, have Brightline, which is a dedicated line to support members of the 2S LGBTQ plus community, as they have often faced discrimination when they do seek supports. And so this line is dedicated to provide them the supports that they need over the phone and to connect them with resources in the community. We have the Psychologists Association, which is a resource for people who have benefits or people who can afford the psychologist fees. There's Drop-In YEG, which offers single sessions, which that one session will provide them with help right there and then, but they'll also be able to refer elsewhere to the community. And then, of course, we have 211. If you forget all of the other numbers, 211 is a helpful number to remember because they can connect you, provide information and referral to all of the community, social, health, and governmental services in Edmonton and in the province, in fact. Just wanted to mention, as I indicated earlier, we do, as part of our goal to increase awareness, but also the capacity to respond to people who may be at risk of suicide, we do provide sponsored training through Living Hope. We have for the last little while, we've had, what we've done is we've contracted with vendors who already provide suicide prevention services. So whether that's Canadian Mental Health Association or Imagine Institute, these are all recognized trainings that meet all of their the credentials and that they're supposed to. So we have applied suicide intervention skills training, otherwise known as ASSIST. We have QPR, we have trauma-informed care, mental health first aid. We have an online Living Works Start, which is it's about an hour and a half, and that one is for anyone 13 and older, which is quite excellent. We've just started on Our Children Are Sacred training, which is for adults to support Indigenous youth who may be at risk of suicide. And then we have other resources on the website, such as counseling on access to lethal means and brain story certification, which talks about the links between trauma and suicide, amongst many other things. And that's updated all the time, and it'll be available the remainder of this year and into next year as well. So that brings me to the end of my part of the webinar and the presentation. So I appreciate your time and attention listening to me speak. It felt unusual just to speak and not have a conversation, but that is the format that we have. So I'm very, very happy to take any questions if there are any. But before that, just a quick again, thank you, and highlighting of the Heart to Heart campaign, which is EPCOR's Heart and Soul Fund that's matching donations up until July 31st. And you can go to, I think, to the Breaking the Silence website for more information there and to donate. And just a thank you to all of the sponsors who have collectively made Breaking the Silence the success that it has been to date. And it's not yet done. So with that, I will ask if there's anybody who has any questions.
Thank you, Leanna. So just another reminder to all of our attendees, please access the chat function for any questions you may have, or if you wish to remain anonymous, the Q&A section is a wonderful place to do that as well. And I believe Leanna will be waiting to answer any questions that pop up. All right, Leanna, we do have a question here for you. First one coming in says, how effective are safety plans?
Well, I don't think there is one consensus on that. And certainly you'll see that reflected in different training modalities that are offered. It certainly used to be the practice, the standard practice for a long time. And certainly when I was initially trained in suicide prevention, contracting with those safety plans was standard. And I think there's been some different thinking over time. So I wouldn't say everyone believes in them equally. I don't know that I'm that I would be in a position to say that they're absolutely necessary or that they're not necessary. I think that's something, given the approach that you take with training and if it feels comfortable, and also what the person, if you're familiar with what should be in those contracts or those safety plans, I think, if that feels comfortable between you and the person being contracted with, then I think that can be quite helpful. But if the idea is scary, I don't think you should be limited by the fact that you don't feel confident in making a contract. I think having the conversation, having it be, making that connection, having it feel meaningful, and having a plan to connect with that person might be the key elements. Whether they adhere to what's in the other details of that contract, I think there's mixed results. I don't think everyone feels that they're equally effective, but if that's the approach that you used and that's what the person who's being contracted with feels will actually support them and help them, then by all means go ahead and use it. I know that's not the most satisfying answer, but there isn't a consensus out there. Not all approaches use it.
Thank you, Leanne. I validate what you're saying. I will transparently share that I am a parent with lived experience on this very topic, and just in the last year and a half had a crisis moment with one of my youth, and I found myself for the first time creating a safety plan for me as the caregiver.
Oh, interesting. Yeah, that makes a lot of sense.
Yeah, and so for myself and in the moment and the timing, it fit, and it became a good tool. Yeah.
Yeah. I think that's a very creative and highly applicable way of thinking about safety plans and contracting, and thinking about safety generally, whether it's formalized into a napkin or a note or on the computer, is different than really the intentionality behind it. But for some, seeing it in print makes a difference. And that's a great idea, Candace. I think that's a really inspiring way to think about it. Really, really appreciate that.
Thank you. Thank you. So I would just encourage, if there are any other further questions that you would like to put out as attendees for this evening, to please do so. I love the question with respects to how effective are safety plans, and your response, Leanna, again, is it's depending on the situation and unique to the circumstance and the individual. And again, that in my lived experience over the last decade has certainly been the case. There's
Mhm.
times a safety plan has been an effective tool, and then there's times when that tool hasn't been the
Yeah.
best choice for us at that time. So yeah, I appreciate your answer of it. It depends, much like everything in mental
So
health.
true. Yep,
Yeah,
so true.
absolutely. All right. Well, we don't have any more questions coming in at this time. What we have done in the past, though, is if there are further questions that do come in, Leanna, we will capture those and you'll have a chance to answer them, and we'll put that back out online for our panel, our participants this evening as well. So
Wonderful. I would appreciate that, Candace. And thank you again to all of the viewers for listening to the webinar and for the question as well.
you're very welcome. Very heavy topic at hand, like you said, but we do thank you so much for your time and your expertise. And yeah, going to take away with me again in my pocket to be brave and just ask the direct question.
Yes.
Thank you.
Excellent. Thank you, Candace. Thank you, everyone.
Good night.
Good night, everyone.